Hello, my name is Rowan.
Hello, my name is Nancy. It's good to have you watching. And today this is Hands-on Health, and our program is through Deaf and Hard of Hearing Services. Today we're going to discuss important health issues, provide more education and empowerment in order to make appropriate decisions. We have a special guest.
Yes, so we're very pleased to welcome Holly DeVivo from Hospice of Michigan, and she'll be explaining more for us about hospice care. So Holly, if you could just let us know your role, your position, how long you've been working with hospice.
Sure. So I am the Grief Support Services Manager for Hospice of Michigan. I have worked there since March of 2021. And my role is to support family members who have lost their loved ones, work through their grief process and go through that grief journey.
I've learned 3 new terms, or I am learning them. If you wouldn't mind specifically naming each term and defining it, would you mind sharing that with us?
Sure. So the first term that we'll talk about today is hospice. And hospice is a type of care that focuses on care and comfort and quality of life as we approach the end of our lives. And hospice is a type of palliative care. Palliative care is any type of care that focuses on pain and symptom management. And these 2 terms can be very confusing for deaf and hard of hearing as well as hearing patients because sometimes they're used interchangeably. And so all hospice care is palliative, but not all palliative care is hospice. So palliative care, a good example of palliative care is if a patient has cancer and they are receiving chemotherapy, they're receiving radiation, and they have nausea, they have pain because of those treatments. The palliative care treats those symptoms and that pain, but that patient is still receiving treatment. When we talk about hospice, we're still providing treatment for pain, for symptoms that a patient may have, but they're no longer receiving treatment for that disease. The third term is caregiver, and that is anyone who provides care to a patient as they are on their end of life journey. That can be a loved one, it can be a friend, it can be one of our hospice nurses, it can be staff in a nursing home. It's anyone who provides care to that patient while they're on the end of life journey.
Okay, so that means for hospice care, that is only for people who are close to death. Is that correct?
Correct. So there are requirements to receive hospice care, and one of them is that there be a prognosis of 6 months or less for end of life. Obviously, none of us know exactly when our time is going to come to an end, so it's an estimate of about 6 months or less before end of life. That's when we would want to have hospice care in. But the sooner you can get hospice care, sometimes the better, because our goal is to promote as many good days as possible. We want to help alleviate pain and symptoms and we want to help promote the best quality of life possible for however long a patient has left.
So when a person knows it's about time, how do we plan accordingly? Who do we ask as far as provision of hospice care? Do we check with a doctor or do we do that on our own? How do we know how to plan ahead of time?
That's a really good question. So for hospice, there are a lot of different choices that you can make with regard to how to get in touch with hospice care and how to receive hospice care. You can ask your physician to connect you with hospice. There are a lot of different hospice organizations in West Michigan, just like there are a lot of doctors. And so sometimes patients don't know that they have the right to choose which hospice they want to use. They don't have to go with the hospice that their doctor recommends or that the hospital works with. They can choose whichever one works best for them. So they can ask the doctor or the hospital for a referral, but you can also contact us directly. You do not need a hospice or a doctor's referral to receive hospice care. You can contact us directly and ask for us to send a nurse out to wherever you call home to do an evaluation and to talk to you about hospice care.
Okay, so what are some of the places that provide hospice care? What are some of the places that hospice care can be provided? Is it at your home? Is it at a hospital? Give us more examples of that.
Sure. Hospice of Michigan provides hospice care wherever the patient calls home. That could be in a house or a condo or an apartment. It could be at a hospital, could be at a nursing home or an assisted living facility. We are a not-for-profit, so we have patients as well who may be experiencing homelessness, and we can provide hospice care in a homeless shelter. We've provided hospice care to patients who have lived underneath bridges. It is wherever the patient calls home, that's where we can provide care.
Hospice and the matter of choice might be overwhelming. Is there, as far as costs involved, do we have to pay out of pocket for costs, or does insurance cover that expense? How do we pay those bills?
Sure. So hospice is a 100% covered benefit with Medicare. So anyone who has Medicare has the right to receive hospice free of charge. It is a 100% covered benefit. And that benefit covers our physician who maintains the prescriptions and the orders for medications, our nurse case manager who comes to the home to provide care. We have a nursing assistant who can come and provide baths and any personal care as well as some companionship. We also have a social worker who can help with things like documentation or referrals to other agencies that might be able to help with social concerns. We also have a chaplain who can come and provide spiritual care, as well as grief support, which is my role. For a year after the patient passes, we stay involved with the family. And then we also have volunteers who can come and provide companionship. All of those things are paid for 100% by Medicare. If a patient has other insurance, most private insurances also cover hospice at 100% or very close to it. The nice thing about Hospice of Michigan is that we are a not-for-profit, and so we have an open access program. So a patient who does not have insurance or cannot afford to pay for care, we can still provide care to that person. Our mission is every person, every time. So regardless of ability to pay or what insurance you have, we will still provide care for you, and we'll use the donor funds to help provide that care.
That's a lot of services that you provide. Wow.
Yes, a lot.
So last week I had looked at your website and I was noticing different services, and one that you provide is counseling. And also about how writing up a will or a power of attorney is done. So could you explain more about that service? Because I know a lot of deaf people here in our community do not understand those two things. So if you could speak about those a little bit more, that'd be great.
Absolutely. We have wonderful social workers who work with the families, the patients and their families, to determine what types of documents might be necessary as we approach end of life. A will is a document that discusses finances, possessions, what will happen to those things after a person passes away. For that, we like to partner with elder law attorneys or attorneys who specialize in those type of documents, because they can get very complicated and our social workers want to make sure that they're done correctly. So we do like to work with attorneys in the community to help with those, but our social workers can connect our patients and families with those attorneys to get those documents taken care of. For advanced directives and powers of attorney, those are documents that our social workers do quite frequently. An advanced directive is a document that talks about what type of care and what type of services a person wants to receive at end of life. So for example, do you want to receive CPR? Do you want to receive a feeding tube? Those are all questions that our social workers can go over with the patient and the family and help get a document that discusses the patient's wishes for those things. And then a medical power of attorney is also one that our social workers help with quite frequently. And that is a document that allows the patient to designate another person to make medical decisions for them when the patient is no longer able to make those decisions for themselves. So if a patient can no longer speak, if they're unconscious, if they have a disease like Alzheimer's that limits their cognitive ability, they can't make decisions for themselves anymore, then they have a written document that provides for another person to make those decisions for them. And our social workers help with that, with those documents quite frequently.
So it seems like with a will and an advanced directive, those require an attorney. Is there a fee for setting those up and for an attorney?
The attorney would set their own fees, and that's going to depend on the individual attorney. For the will, for the advanced directive and the power of attorney, those are services, those are documents that our social workers can help with, and that's included in the services that Hospice of Michigan provides.
So we don't have to worry about power of attorney and all those issues because we have hospice that will cover all those aspects and work together as a team. Is that correct? Is it teamwork with social work, attorneys, and hospice? Do you all work cooperatively?
We do work as a team. We focus on providing a care team for the patient and their families. We always recommend that anyone, regardless of age or health, have an advanced directive and a power of attorney ready to go, because we never know what's going to happen in our lives. But if you get to the point where you're ready for hospice and you don't have those documents, then our social workers can absolutely help you get those ready to go once you come onto our services. The attorney would be separate outside of our organization, but the social worker will help facilitate that relationship and help you get connected and get the documents that you need, and also just talk to you about what your wishes are so that when you do talk to the attorney, you have a good idea about what you want to include in your will.
Yeah, I think we'll change the subject just a little bit. So talking about family and caregivers, if you have a patient, and also you have a loved one, and you feel like, obviously you're going through grief. You've already explained that hospice provides grief services and care for the families. Do you also provide training for people who are taking care of patients, for the caregiver?
We provide a lot of education for caregivers, especially family members and friends who are taking care of their loved one. Our nurses go into the home at least once a week, and we recognize we are not in the home, we are not in the nursing home every day. The family is usually the primary caregiver, and we come in to help support the primary caregivers. So we provide a lot of education on different ways to provide care. So we can educate about how to give medications. We can educate about how to change dressings, or how to help support someone who maybe needs a little bit of help walking. We provide a lot of education to the family that is taking care of the patient. That's one of our nurses' favorite things to do, because we want to make sure that our patients are well taken care of when we're not able to be in the home.
I know there's someone that mentioned having a roommate and a caregiver support person, and it just so happened that someone else said you can't go into a hospital, and there was this discussion with the care person because they said you have to have certification. So do you have to have certification based on the fact that you are friends? I'm a little bit confused on that. Can you explain that?
Sure. We don't require any type of certification to be a caregiver in the home. There may be times where a caregiver is working on being paid as a caregiver, where certification might become a question. But if you are simply there because you love this person and you want to provide care for them, we don't require any level of certification. Our staff are certified, but if your loved one or your best friend want to provide care for you, they have every right to do that. That's not a problem. We encourage caregivers to be in the home and to provide that care and companionship to patients as they approach end of life.
Okay, I just want to clarify something. You had said that you were confused about the certification and also the power of attorney issue. So I'm just guessing that if the caregiver wants to go with their loved one to the hospital or whatever, do they have to be the one that is the power of attorney to then go into the hospital with their loved one and speak with the doctor and things like that?
Each hospital is going to have its own rules, but generally, if the patient is able to speak for themselves and have and make their own decisions, then they should be able to have any caregiver they want in the hospital with them. If the patient is no longer able to make decisions for themselves, then the doctors at the hospital are going to want the person that has the power of attorney in the hospital with them so that they can make those decisions if they need to be made. But if the patient is able to make their own decisions and they don't need the power of attorney, then it should be any caregiver that they want present with them.
Okay, now I get it. Say, for example, my brother is caregiver and goes with my mother to the hospital to talk about medical issues and give my mother opinions and so on. And again, I'm calling him the caregiver. But at the same time, he has power of attorney as well, and also has a will in hand because my mother's wishes are all included there. Okay. Yes, thank you. It's complicated.
Yes, it is complicated.
It is very complicated for everyone, for deaf and hard of hearing patients as well as hearing patients. There is a lot involved with power of attorneys and advanced directives, and we don't like to talk about it because it has to do with death and dying, and we don't want to talk about it. And so when we need it, sometimes we don't have it, and that can create a lot of confusion.
Yeah, so suppose you have a patient who does not have any family members that can take care of them and provide care, and maybe no friends who are able to provide care. What should that patient do?
That's a good question.
That is a great question. That's one of the things that our social workers can help with. Our social workers and us as an organization regularly work with patients, even patients who have family, but their family is unable to care for them. They may have a spouse who is elderly and frail and can't take care of them in the home. And so we work with nursing homes and assisted living facilities in the area to help with placement in those facilities, so that if the family cannot care for the patient, they can be in a place that is safe for them to receive care from professional caregivers.
I'm happy to know how this system works. You're looking at a social worker, attorney, hospice, so I have a better picture of how it works.
Yeah, I also understand it better too, because hospice has so many services that they provide, and I'm thinking, we have to do the research and find the right hospice, but they provide so much themselves.
Yeah, but in thinking about hospice, I didn't understand what all it included, so I'm glad you're here. And I have no further questions. We want to thank you for being here. It's such good, useful information for us.
Yes, thank you so much for coming, Holly. We really appreciate it. And thank you for joining us today and watching our program. We hope that you enjoyed our show and that you learned a lot. And we hope that you continue to watch as we discuss other health issues. You can follow Deaf and Hard of Hearing Services on Facebook. You can subscribe on our YouTube channel. And you can see all of our programs there as well that we've published before. If you want to support us, you can donate at www.deafhhs.org/donate. If you have suggestions for other topics that you would like for us to discuss during our show, you can easily email us at hands-on health@deafhhs.org. Thank you so much.
Thank you.
Thank you, Holly.
Thank you.
My pleasure.